Okay, a warm welcome from me to this series of video presentations on the role of bisphosphonates in the treatment of Paget's disease. My name is Stuart Ralston and I'm chairman of the Paget's Association. And we're presenting these videos in celebration of Paget's Awareness Day on the 11th of January 2021, which will mark the 207th anniversary of the birth of Sir James Paget. Now, it's my great pleasure to welcome today Dr. Roger Smith, who I think is fair to say is a legend in the field of bone and mineral metabolism. And he's kindly agreed to talk to us about some of the early clinical research that he carried out on the effects of the bisphosphonate etidronate in Paget's disease of bone. Roger, we know each other well and have done for many years, but maybe you could say a few words about yourself for the few people that perhaps hadn't heard of you. Please.
Well, yes. In my early career, I went from Cambridge to UCH, University College Hospital, and then on to the MRC unit in Jamaica, where I was interested in the biochemistry of severe starvation, and that's what I wrote my first thesis on. And then I had various jobs subsequently, and including one in Los Angeles, and eventually finished up with Charles Dent, Professor Charles Dent, who had a considerable number of very interesting patients. And by that time I had become interested in collagen and hydroxyproline, and that's when I did my second thesis on a PhD thesis on hydroxyproline and its disorders. And then subsequently I had a senior Wellcome Research Fellowship. After that I went to Oxford to a combined appointment between the departments of medicine and orthopedic surgery, and I knew Graham. Graham was in Oxford at that time, and that's where we got together on Paget's disease. And he of course had done all his splendid work on the mineral side of things, and I was able to fill in with the matrix disorders of the bone matrix with my knowledge of hydroxyproline. So that's the beginning.
Thank you, Roger. It's a fascinating and varied career. We did share both having a Wellcome senior fellowship, but I missed out on the transfers to Los Angeles and Jamaica. But there you go, that's water under the bridge. Now, we heard from Graham already in another interview about the work he did with Herbie Flash. But maybe what I could do is take you back to the early 1970s, maybe in the time just before you published that seminal paper in the Lancet using etidronate in Paget's disease. I think I'm correct in saying that was the first description of the use of any bisphosphonate in humans, and certainly the first in Paget's disease. So it must have been a very interesting time. What prompted you to study etidronate in that situation? And yeah, just tell us how it all started.
Well, it's really a coincidence. Graham was in Oxford. I was offered a place in Oxford and joined him. So that got us together. Thinking along the same things with very different backgrounds, and Paget's disease is common. At least it was very common in an orthopedic hospital where I had most of my position, and the metabolic facilities and metabolic beds, and of course. We decided to see what effect this magic compound, which Graham had done so much work on.
Okay, so, and the landscape, the treatment landscape at that time, you were seeing patients with Paget's disease before retidronate came along, how would you describe the treatment options for those patients?
Not much, of course. There's the big gap between Paget himself and the possibility of treatment. In an orthopedic hospital, the treatment would be orthopedic, of course, and there was very little that you could do. I think, yes, there were no significant treatments.
Yeah, I think maybe looking at the discussion of your paper, there was mithromycin was around. Obviously, that was cytotoxic. Would that have been maybe before the time that calcitonin was used, or around the same time calcitonin started to be used?
Around the same time, I think, yes.
Okay.
There was a temporary enthusiasm for calcitonin.
Okay, so I read your paper many times, and in fact, I think you commented on the fact that the biochemistry didn't always go with a patient's symptoms. And I think I think it was maybe 4 patients you studied, and you mentioned one of the patients had obviously a very high ALP, but not many symptoms. Of course, the ALP fell with the drug, and then you had another patient that didn't have much of an elevation in ALP, and he had a lot of symptoms, but interestingly, the second patient with the kind of not very elevated ALP did respond. So what was your thought? I mean, why was that happening? We always think of high ALP being associated with pain, but certainly my experience is those two things don't always go together. And was that something you saw at that time also?
Well, yes, certainly. I think you don't necessarily expect a close association between the biochemistry and the clinical features. It depends. The alkaline phosphatase varies with the phase of the Paget disease, and when does the Paget disease start? Who knows?
Exactly. Well, hopefully we'll start to find that out at some point, now that we have ways of predicting people who are going to get Paget's disease by genetic testing. And that's one thing we're going to come to later in this series of videos. Now, I know that you've had a long-standing interest, kind of mainly in rare bone diseases, I think it's fair to say. And I'm a proud owner of your 2015 textbook, which is beautifully written, if I may say. I wondered if you had any words of wisdom for young aspiring physicians like myself who may be watching this series of video diaries with us today.
Well, I think it's just curiosity. If you're the inborn errors of metabolism are really signals provided by whoever provides these disorders to encourage you to discover what's going on.
Thanks very much, Roger. I think those are very wise words. And of course, over recent years, we've learned a huge amount about these rare diseases. And I think Paget's disease probably counts as a rare disease now. And as you mentioned, maybe that will give us insights moving ahead into all sorts of things. Now, I'd like to thank you today. I feel honored to have been able to talk to you today about your experience back then and in general. I wish you luck with the next edition of your textbook. I hope there's going to be another edition coming out. Paul Wordsworth, no doubt. And thanks once again.
I've given up writing at 90.
Oh, no, surely not. Okay, well, thank you, Roger. And I hope everyone that's watching enjoyed the interview. And I hope you'll tune in for some of the other interviews we have in this series, which will track the developments in bisphosphonates. Thank you once again.
Thank you.